a few minutes beyond 10:45, so I think everyone who means to be here is here. Megan, are we good? Where's that weird camera thing? Are we, okay, that was just a one-time thing? All right. Well, thanks everyone for being here. First, we do have several exciting announcements, but first I want to just a chance to wish the kids and the teachers who are heading back to school a safe and productive school year. I know last year was incredibly challenging, and this year is starting off with its own challenges, but we know that our teachers have the best for our kids and want the best for our kids, and I think that everyone's really excited to be back in the classroom. I know my kids are, and today AJ got dropped off, and Chelsea said that he was both nervous and excited, so it's a fun time right now, and we're hoping everyone stays healthy and safe. So towards the end of today's discussion, we are going to talk with the County Health Director, Adrian Burns, on the current health recommendations and get to that. But before we do have an update from the library with the Evergreen Community Center renaming and the library cards. So with that, I want to welcome back Sean, who's just been a constant with our media briefings because they're doing so much great stuff with the library. So Sean, welcome back, and I'd love to hear what else we have going on.
Thank you, Mayor. All right, so earlier this summer, the library and the Office of Community Services teamed up to gather naming recommendations from residents in the North End for our new community center, which is currently under construction at the Evergreen Branch Library at 2601 North Arkansas. City Council member Cindy Claycomb is leading this project. It will combine the Evergreen Library, Evergreen Neighborhood Resource Center, Empower Evergreen, and several other community organizations into one central location residents can access. It's designed as a one-stop shop to fulfill community needs. We've had staff go in and out to kind of see what the construction process is looking like, and as walls are going up and the space is transformed, the excitement is building. So we're really excited to move in here shortly. The Library Board of Directors, serving as the naming advisory committee for this project, narrowed the list down of names to its top recommendations and are now gathering resident feedback on the top 5 names before making a final selection on the name this fall. The 5 recommendations under consideration are El Norte, which translates to the North in Spanish, Artega for Cirillo Artega, a community member known for creating a recreation center in the El Pueblo neighborhood, Evergreen, which is the current name of the library and the Neighborhood Resource Center, El Pueblo, which translates to the village in Spanish and is also the name of the neighborhood, and Adelante, which translates to go ahead or move forward in Spanish. Residents can visit the City of Wichita website to complete the ranked choice voting survey to place the top 5 recommendations in order from their most favorite to their least. And the results from the survey will guide the Naming Advisory Committee in its discussion to select a name that will go before City Council for approval this fall. And then for library cards, it's back to school time, and the library is encouraging parents, caregivers, and educators to register their students for a library card. A library card is a free resource students can use to access physical and digital materials, research databases, and other services at any library location. There are 2 types of cards students can register for. A traditional borrower's card lets students access all digital library services online, as well as check out physical materials from all library locations like books and DVDs. And an e-card gives students access to digital library resources only, like ebooks, audiobooks, digital magazines, and the online research databases. More information about library cards is available at wichitalibrary.org. That's all I have today.
Thank you, Sean. We appreciate everything you all are doing with the library and with collaborative efforts with our community centers, so thank you. So during COVID, one of the things that we noticed was folks were getting outside more and becoming more active, and we saw just a rise in popularity when it came to disc golf. So with that, we have been responding to the popularity and really the need for folks who are interested in playing disc golf with more with more amenities. So with that, we'll go ahead and give the floor to our Parks Director, who can come on up here and tell us more about it. So Troy.
Good morning, Mayor. Thank you very much for your time. And let me be here. So if you like disc golf, we have some great news, and a lot of great things are happening over at the Evergreen neighborhood area. So we opened up a brand new 9-hole disc golf course over at Evergreen. And this was a great idea because we have a lot of open space in this park. And the idea came through Council Member Claycomb's office, and she set up the meeting, and she kind of set us up in the right direction for getting the right resources for this disc golf course. And it's just been a blast. We opened it up in June, and since then we've seen a lot of folks taking advantage of the disc golf course. And this just adds on is a great complementary course to all the other courses we have. We have several ones I'm going to go ahead and mention over at Cessna West, which is at 5701 Kincaid. That's one of our disc golf courses. We have one over at Clapp Park. That one's really popular, and we actually have a great big tournament this weekend there. Herman Hill is known throughout the whole state as one of the great disc golf courses. We have Oak Park, also West Millbrook, and now over at Evergreen. And so when I've talked to some of the disc golf folks, they really like this course over at Evergreen because it's a great starter course. And of course, it's going to be for free. All these disc golf courses are free. In October, we're going to be hosting 2 workshops to teach all the people in the neighborhood how to play disc golf. And it's really easy, but if you don't know, you don't know. And so we'll have some discs out there, different size discs, and show them how to use them and learn how to play the game just to get more active. And just as the mayor was talking about, during COVID, we found huge amounts of people using our parks. The way I can tell is because they left all their trash there. But beyond that, the parking lots were full, and we've gotten a lot of great comments about our parks. Also, something that was really kind of neat, if you are a disc golfer, you might know about a mobile app that's called UDisc, and you can download that, and it has a map of all of our disc golf courses here in Wichita, actually all of them across the country, but specifically here in Wichita. So if you want to learn more about the sport, feel free to give us a call, or you could check us out on the website to get more information about our disc golf. I think disc golf is going to be getting more and more popular here in Wichita, and we're going to be accommodating that. So thanks for letting me give the update.
All right, so with that, we're going to jump right into the health recommendation update, and we welcome back over to City Hall our friend Adrienne Burns, who is the director of the Sedgwick County Health Department, and she's going to give us an update on our current status with COVID.
Thank you, Mayor Whipple. Good morning. So last week, our health officer, Dr. Mintz, made the strong recommendation of everyone wearing masks. And why is this? Our hospitals have increasing cases of COVID, and 97% are all unvaccinated people. We have 46.4% of Sedgwick County residents 12 and older that are able to be vaccinated are vaccinated. Of our whole population, 38.6 people are vaccinated. We have Delta variant in our community. We're not surprised that the virus mutated. That's what they do. Sometimes they are not very harmful, and sometimes they are. And Delta variant is very harmful. It is much more infectious. Twice as many people seem to be getting Delta. In May, less than 1% of our cases were of the Delta variant. As of July, over 80% of our cases were Delta. And again, it is more contagious. There have been some breakthrough cases. They are very minor, or very small percentage. A vaccine is very effective. It is not 100%, and so there are going to be some breakthrough cases. The data is showing that the vaccine is still very effective because it is doing what it said it would do, and that is by and large keeping people from dying and keeping from severe disease and in the hospital. Not 100%, but by and large, it is working when people are getting COVID after being vaccinated. And fully vaccinated is 2 weeks after either the Johnson & Johnson 1 dose or after 2 weeks after the second dose. We have plenty of vaccine available for our community. Not only is Sedgwick County Health Department vaccinating at 223 South Main Street, but there are providers, there are Dillon's, pharmacies, so vaccine is to be had. Please get vaccinated. Thank you.
All right, so with that, we'll take questions on anything.
I have a couple questions, one on COVID and another one on the update for the naming of the community center. So obviously all of the names are Hispanic. This is a clear reflection of the people who live there and a reflection of the importance of diversity for the city of Wichita. What's your favorite?
It's my favorite name. I actually like naming after leaders, to be honest, after community leaders. I think that when you can name something after a community leader, someone who put in the time, not only does that reflect the hard work of folks who've come before us, but also I think it encourages folks that there are people like them, like us, who have really reached out to try to make things happen. So I think it's one of the names. Oh, one of the potential names besides the current one that's actually named after a person. Is that correct? Cirillo Arteca. Of course, I probably didn't pronounce it as well as Troy would have. But that would, if I was to influence the vote on this, and no one likes me influencing votes in this building, but I would probably go that route where, naming after a community leader just to honor the community service that was put in.
And another question, what is the timeline for the opening of this community center? How's it?
Timeline? What is the timeline? I know it's usually a variant timeline in case something comes up, but.
Right now, we're anticipating December or January as the opening for the community center. I believe the last update meeting we had, everything's on track with construction, and we'll take the naming recommendation to council in October, so we should have a name by then. So December, January, in that time frame is what we're aiming for right now.
What's going to,
Go ahead.
sorry, just to finish, what's going to happen with the current facility where the Evergreen Community Center is? What's going to happen to that?
I'm not entirely sure. Councilmember Clayco might be able to better answer that. Park and Rec? Yeah. I'll turn the mic over to her.
You're asking about the current neighborhood center and what will happen with that. We're not sure right now, but what we are aiming for is that whatever goes into that building supports the mission and purpose of what we're doing over at the community center. So we're really focusing on workforce and career readiness, education, and small business development. So we're looking at some partners to help us out in that current space.
So I don't know who can answer this question. I'm curious to know what's going to go into this building that is being constructed. What services are going to be offered? So I don't know, Mayor, you can answer that question, or?
I also provided an update on it. So, Sean.
So as far as city facilities that are going in there right now, it's going to be the Evergreen Library, or whatever the new name of the library will be with the naming of the community center. The Neighborhood Resource Center that's over in the Evergreen Complex will move over there as well. And then the new nonprofit organization that was started, Empower Evergreen. And then there's a myriad of other community organizations that are either going to be in there or hoping to be in there at some point. I don't have specific names for those, but there's going to be a ton of different community resources available in one roof, under one roof. So community members can just come in and use the library, use city resources and services, and then you get other assistance as they need it.
Other questions?
I have
Go ahead. I don't know who can answer this, but the popularity of disc golf, why all of a sudden this thing's just taking...
It's there, isn't it? Yeah.
So,
It's taken over. I think it's my.
I don't know if you can answer that.
I mean, I could, but I shouldn't say what I was thinking. I was going to say, like, if you look at my friends list, it's usually dads who want to get out, and it's the type of sport that they could play without I guess, having to do too much with learning rules. It's a pretty easy sport to play. I think that's part of its popularity. It's fun. It gets you out there. And utilizing our courses that we have, it just breathes new life into our communities. So, I think that there's a variety of reasons why it's being popular. It's easy to play. You don't have to be in incredible athletic shape to play it. And again, it's one of the things we've seen with COVID, if we were to look at silver linings, one of them is folks getting back out and rediscovering our parks, rediscovering just some of the amenities that we offer throughout our city. And I think that's part of it too. It's a really good reason to go out and check out some of the great stuff we have in our current parks.
I have a question for Adrian. Like, are more and more people getting tested, and how's that going? And
Again, can you talk about the spread, the number?
Yes. We have definitely seen an increase in testing. This week, it's probably tripled from what it has been. So we're currently looking at another location because that many people at our current location at Sedgwick County Park is a little bit too much, as far as social distancing and being safe. And I did want to add that last week we had over 1,100 new cases. So our cases are growing at an alarming rate. But yes, testing is up, and first vaccinations are up. Not as much as we would like, but they are up.
what do you think is driving that people are wanting to get tested?
Well, really trying to educate people that just because they're vaccinated doesn't mean that they're in the free and clear. Again, the vaccine is it's doing its job, but it's not 100%. And so if someone doesn't feel well, and as we head into flu season, any kind of respiratory illness, it's going to be important to get tested just so they can rule that out.
How do you feel about masks in general? Would you like to see it basically however people feel about wearing them, or would you like to see it more mandated?
We know that masks are one of the tools we have in our toolbox that are very effective. And that I would encourage everybody to wear a mask. I'm vaccinated, and who wouldn't like to be done with masks? But we know that masks help quite a bit in slowing down the spread.
Any word on a possible booster shot down the road?
There may be a booster shot. News just came out last night for those individuals with compromised immune systems. The immunization group will be meeting on Friday. We'll see what comes of that, because then CDC needs to make their announcement, and then KDHE, and then we follow KDHE. So don't know much more than that at this point.
Director, with going back to school, there's some parents who've expressed to us concern about kids being in the classroom, social distancing being an issue or a challenge. What kind of words of reassurance can you give them, or advice to ease that stress, given that they don't have the option like they did last year of keeping the kids doing school online?
And I can appreciate that. I have 2 granddaughters starting kindergarten this year. The schools did a good job last year, even when they were in session, distancing, and few were able to do 6 feet. 3 feet was a whole lot more doable. They are going to be as vigilant as ever, and, with helping kids keep their fingers away from their eyes, nose, and mouth, because that is the biggest way that all of us spread, because most of us don't get sneezed or coughed on. And so what we do with our hands really gives it a route into our body. So I can just tell you that, we're working with the school systems as we always do, and they want to keep the kids in school. They want to keep themselves in school and not sick. So they're going to do everything that they can to make it as safe as possible.
In terms of any other advice for parents? 'Cause-
I would encourage parents to have their children wear masks. And my oldest is a kindergarten teacher, and she recommended disposable masks just because the younger kids she saw last year tended not to chew on the disposable masks as much, and they seemed to be a little bit more breathable. So I bought a whole bunch of disposable masks for my granddaughters.
Thank you.
Yeah, not touching that for a second. As a dad of 3 who are all under the age of 8, I think that you get the masks that have like a picture of a shark smiling or something. That does get chewed on, and throughout the day, we usually can only wear those for short term. But Amazon, our local stores have well-fitted children's masks that are N95s now, and those we found are not only more comfortable but stay on a kid's face better. And of course, since they are N95 and our kids might be exposed to folks who aren't wearing masks, that will filter out those droplets that carry the virus likely a little better than a cloth mask would. Looking to see the nod on that. That's what I'm pretty been reading, that the masks, the N95s are better than the cloth ones, but of course, any mask is better than no mask.
Mayor, are you concerned about the trend of the new COVID cases, especially Delta variants?
Yeah, I wouldn't be a very good mayor if I wasn't concerned about that. Incredibly concerned with it for a few reasons. One, we are having kids back in school, and 100% of our kids under the age of 12 are not vaccinated. And there's over 4,000 variants of the COVID virus. Not all of them make the news. Not all of them make this thing either stronger or more contagious. But I do worry, and I've been somewhat vocal about this, that I don't want our kids or schools to be a petri dish for that next variant. So I'm worried until children have an opportunity to get a vaccine, that if we're not taking all precautions, how the Delta and the next variant affects our kids. I am concerned because this thing changes at a pace that we haven't seen before, meaning that if we are making policy off of last year's Alpha variant, or last year's COVID, and then I think we had the Alpha variant, then we're making policy off last year's COVID, and this year's a different COVID, a stronger one. So I'm concerned because not only being mayor, but really as a dad going into this, we still don't know the long-term effects of COVID, so it's definitely something to be concerned about.
Thank you.
Which is why I work with Adrian and our friends over at the County Board of Health to try to get as much accurate information out as possible, try to tell folks the best methods we currently have to keep people safe, and that is masking up. Every major medical association who has spoken out about this has recommended that kids wear masks. And it's not just recommended because it's optional. It's recommended because they want kids to wear masks, and I think that we need to really highlight that.
Shifting gears, can you comment about the police chief taking his name out of the police chief job in Austin?
I don't have a lot of information on it. I just know that he will be here for the foreseeable future at this time, and he's not going to go to Austin. That was the best update I got so far, and and he's doing a great job here. We've just seen lots of very positive reform in our community policing efforts. We are seeing officers not just in neighborhoods when there's a problem, but when there's not a problem, building those relationships that the data, that the social science says helps us create more safer communities. And I'm really proud that this budget that we have, if it is to pass the way it is, will fully fund our police up to phase 2 of the academic study, which means, and while also adding social service providers alongside our police officers to continue down the best practice of community policing and to build upon that. And, Chief Ramsey is one of the best police chiefs in the country, so that we will have him to help us give the resource he needs to implement these strategies. I think is going to have just a community-wide benefit. Anything else? All right, cool. You guys look very serious looks on your face, but yes, now the smile and the thumbs up makes me say, like, all right, I didn't say anything too crazy. Thank you, guys.